March 30th, 2015 marked a new day for healthcare on Virgin Gorda as government takes the first step to begin construction work on the $5.9 million state-of-the-art Virgin Gorda Nurse Iris O'Neill Medical Center. Addressing the contract signing and groundbreaking ceremony at the site for the new health center adjacent to the existing Iris O'Neill Clinic, Premier Dr. D. Orlando Smith recounted his early duties as a medical officer dating back to 1969. Dr. Smith said since 1979, he saw the need for an upgraded health facility on Virgin Gorda, and his administration has taken swift action to provide quality health care.
Then in 1979, when as Chief Medical Officer, I was in a position to advise ministers on health policy. I envisioned a new Iris O'Neill Medical Center with new services, extending operational hours, more equipment, and more nurses and doctors and staff. And we did work towards making that a reality. Many of you would remember, for example, that I had persons like the late Dr. Bulle living on island who made it much simpler. Subsequently, we moved up to having an office on island permanently. As I traveled here to Virgin Gorda to provide health care to many patients, my desire to see a larger and modern medical facility grew even stronger. And the more I waited for patients to travel via boat to People's Hospital for emergency care, my desire for a well-equipped medical center in Virgin Gorda deepened even more. As a surgeon, one of two for many years, we took care of the people of Virgin Gorda, as with the rest of Tortola, at People's Hospital, who needed treatment. And as always, I am pleased to see several persons I was able to help amongst us today. As Premier and your leader, today I'm pleased to be part of this historic occasion. Families have spoken, we heard. Patients have spoken, we listened. We know the transportation challenges you've endured, and that is why we are taking swift action. It is about time that we reach this point to provide quality health care right here on island without the need to incur the expense and hassle of emergency travel to Tortola.
The medical center will operate on a 24-hour basis, and plans are to implement an air ambulance service between the sister island and Tortola. Health Minister Ronnie Skelton says the emergency ambulance boat will soon be available to provide services from Virgin Gorda to People's Hospital.
This phase of the project will feature a modern laboratory, pharmacy, imaging room, procedure and treatment rooms, an accident and emergency room designed to be fitted out with the state-of-the-art equipment, a security counter, nurse station, and a reception area with 25 indoor seats and 28 outdoor seats, and public restroom facilities. The ground will be well lit, beautifully landscaped, and will include 25 parking spaces with 3 for the differently abled, 25 staff parking spaces, and a driveway to overflow parking. The facility will also feature an ambulance bay, a patient drop-off location, and backup generating capacity. So fellow Virgin Islanders and friends, the entire BVI community welcomes the news that this long-anticipated modern facility is now becoming a reality. Our long-term vision is to one day commission an air ambulance service and a modern ambulance boat to take patients from the sister islands to People's Hospital. But ladies and gentlemen, in the meantime, I am happy to report that repairs have been completed on motor vessel Vigilant 2, which will be used for emergency medical transfer from Virgin Gorda to Tortola. I must say the vessel required more extensive repairs than we realized when it was first handed over to us, and the repair work took a lot longer than we anticipated. The boat is now seaworthy, and we are making final arrangement to hire a captain and crew to operate it in partnership with the Fire and Rescue Services Department here on Virgin Gorda.
James Stadman, director at James Stadman Construction, the contractor for Virgin Gorda Nurse Iris O'Neill Medical Center, said his company has a record for completing projects on time and within budget. He expressed gratitude to former Premier Ralph O'Neill and current Premier Dr. Orlando Smith and his administration for helping him to become a leading construction company locally and across the Caribbean. Celebrating his company's 28th year in business, Mr. Tadman donated $28,000 to the project.
On behalf of my family and James Tadman Construction, we want to be the first to donate $28,000 to the Iris O'Neill Clinic for medical furniture. And that $28,000 represents, you wonder why 28? We is on the eve of 28 years celebration of James Stadman Construction. A few years ago it was 25, we is on the eve of 28 years. I will do my best in Virgin Gorda as I done in Tortola. And James Stadman Construction will involve whoever is possible and able to do anything to have this project complete. We will share the pie. People of Virgin Gorda, have no fear. James Stadman Construction is over here.
Virgin Gorda Representative Ralph O'Neill says the land for the Nurse Iris O'Neill Medical Center was previously purchased by Lawrence Rockefeller during the Virgin Gorda Airport construction, and he said it was cleared 3 times, and he's glad that action has been taken to begin construction.
But this same piece of land we took back from Mr. Rockefeller when we took 3 pieces. One piece at Hill of the Bay, another piece at out where the water, King Water Facility, and this. So it worked in our favor, this piece of land. And as far as I know, it was trimmed down 3 times. I don't know if the present government got any time that they had it trimmed down, but and when we presented the scheme to the people, they found it some faults and they wanted that fixed, and it was past the architect to do, and I don't know what happened after that. I know that he didn't get the start. But I'm very glad today to see that action has been taken.
Services at the Nurse Iris O'Neill Medical Center, when completed, will include emergency care, dental health services, family health programs, health promotion and education services, radiology, stabilization for emergency transfers, as well as pharmacy, physiotherapy, rehabilitation, and laboratory services.